Little league elbow is one of the most common injuries I see in high school or younger baseball players. So I want to talk to you today about what it is, common signs and symptoms, and what return to throwing or return to games looks like for this injury. So little league elbow is a growth plate injury at that medial epicondyle, and it's an overuse injury due to repetitive valgus stresses from throwing or from pitching on that growth plate. And you'll get some type of inflammation. You'll get some type of widening. In severe cases, you could potentially get stress fractures, which that's a topic for another day. But if it's a severe enough stress fracture where there's almost displacement, those might require surgical intervention. Signs and symptoms of little league elbow. First and foremost, we need to shut down from hitting and throwing when this is suspected. We need to let that growth plate calm down and heal. Typically, guys will report almost like they're losing extension. They're losing the ability to straighten their arm. And that is because as you're extending your arm out, you're pulling on that growth plate. And if it's inflamed, irritated, it is not going to like that. So that's one of the first things we focus on in rehab is getting full elbow extension back. Next, some pitchers or baseball players will notice that their arm is swollen directly, immediately after they pitch. Another sign and symptoms that I will look for is they will experience either pain in maximum layback where they have maximum valgus stress on that elbow, or when they're accelerating or at release and they have to close down maximally on that elbow. From a rehab standpoint, again, we are shutting down from any type of baseball activities for, on average, I would say 5 to 6 weeks. We need to let that growth plate calm down. We have to get range of motion back, start some strength work, get you back in the gym from a weightlifting standpoint, and get some upper body plyometrics, medicine ball, plyo ball drills. Once we can comfortably see that you have strength, range of motion, and the ability to tolerate those plyometrics, then we start a throwing progression. What I will say here, and this is probably one of the most important points, is we don't go for those 6 weeks of rehab and then jump right back into games. That is a recipe for disaster and re-injury. It's probably going to be another 6 to probably 8 weeks of starting on flat ground, working into the mound, and then eventually getting back into games to really just re-expose stress to that arm. And again, it's a gradual process. So generally with these rehabs, we're looking at probably about a 2.5 to 3 month process. And that can differ for each individual, but that's roughly what a timeline can look like for those suffering from little league elbow.